In the face of growing NHS pressures, community pharmacies are here to help. As a critical part of primary care, community pharmacies already provide essential support to patients and local communities, but we believe they have the potential to do even more. They are uniquely placed to support primary care colleagues and deliver healthcare services in an efficient, accessible, cost-effective way, reducing pressures elsewhere. At Community Pharmacy England, we lead national work to support community pharmacies, working closely with local pharmaceutical committees who represent pharmacies in local systems. Pharmacies are currently facing very serious pressures, and as well as easing these, we want to empower them to go even further. We asked Nuffield Trust and the King's Fund to look at this, and they have set out a bold vision for the future, in which pharmacies will transform over the next decade to do even more to support health outcomes. Sitting in the heart of local communities, pharmacies will continue to be a key doorway into the NHS, dispensing essential medicines to patients. The pharmacies of tomorrow will offer a wider range of preventative services such as vaccinations, smoking cessation advice, and access to testing services. They will provide more clinical care, acting as a first port of call for a variety of common illnesses, as well as taking on the management of patients with some long-term conditions, such as asthma or diabetes. Pharmacies will offer holistic, person-centred care, with all team members upskilled to help their pharmacists make the most of independent prescribing and other enablers, such as patient group directions. All of this will help improve outcomes, increase safety, and deliver better value for the public and NHS. However, achieving pharmacy's full potential will require cooperation across the health service, with NHS integrated care boards and local government actively engaging with community pharmacies. From the local commissioning and contracting of services to supporting workforce and training needs, ICS leaders will need to work with pharmacies to make sure they are appropriately funded and supported. This will require collaborative effort, with ICB chief pharmacists working with local pharmaceutical committees and others to provide strong system leadership for pharmacy. We also have a role to play. At Community Pharmacy England, we want to work with NHS England and government to ensure pharmacies are sustainably funded and set out a menu of service options from which local leaders can choose. Our focus will be on building capacity and capability in community pharmacies to collaborate and expand their service offering. Together, we can create a pharmacy service built for the future for the benefit of patients, communities, and the wider NHS. For more information, contact your local pharmaceutical committee.